I'm Sandra Cockfield. I'm the medical director of the renal transplant program here at the University of Alberta Hospital. There are two basic types of dialysis. Both types do require a surgical procedure in order to prepare the patient. With one type, which is a form of dialysis through the abdominal cavity, we put the catheter in for that at least 6 weeks before we anticipate dialysis would be needed. The other form of dialysis, which is the more common form, involves taking blood out of the patient, circulating it through a dialysis machine, and returning it to the patient. And that ideally requires creation of a proper vascular access in the arm, and that requires surgery to sort of redesign the blood vessels in the arm so that we can use it after it develops to be big enough to needle and have the blood go in and out through that system. It's what we call a central venous catheter. These are specialized intravenous's. They're large bore, and they go into a central vein in the chest. So usually they go into the bottom of this vein in your neck, and it's rerouted through the skin, so it looks like it comes out of the chest wall, but it's actually from this blood vessel here. And so we will put those in if a patient presents suddenly needing dialysis and has had no preparation for hemodialysis, so we don't have anything that's usable in the arm, or if the attempt to create the vascular access in the arm has failed and isn't mature enough to be able to be used. And sometimes patients just don't have good blood vessels. They've been abused over the years with lots of intravenous's or blood pokes, and so they just don't develop, and in that case we have to use a catheter.